All right, let's dive into a topic that always gets the heart-racing epidemics, but hey, thankfully there are brilliant minds always working on this stuff. Today's deep dive, we're going old school, using a World Health Organization guide. Get this, from 1986.
Wow, back in the day. 1986.
Well, public health action and emergencies caused by epidemic. I know, right? You're thinking 1986. Really? But trust me on this one, this document, it's a gold mine. Seriously.
Oh,
Full of insights into how we, as humans, tackle outbreaks.
yeah.
It's like peeking into a time capsule, seeing how the pros used to handle this.
It's fascinating how much of that stuff, those core principles, I mean, they still hold up even today. You think about all the medical advancements we've made, but the fundamentals, they haven't changed all that much.
You're right. It's actually kind of reassuring in a way. Like, okay, the foundation is solid. But before we get too deep into it, let's start with the basics. Like, what exactly screams epidemic emergency?
Right.
How do we even know when things are bad enough to slap that label on it?
You'd think there'd be like this universal alarm bell. But honestly, it's way trickier than that. The
Yeah.
document even points out what actually makes an emergency. It can be different from country to country. It all depends on, like, the context.
Oh, I see.
Just imagine like a sudden outbreak of smallpox, but in a place where, boom, it's never been seen before.
Yeah.
That's a huge red flag,
Yeah.
right? Because nobody's got any immunity built up.
Right. But if smallpox is already hanging out in a region, even if cases start going up, it might not be an immediate, like, everybody panic situation.
Exactly. It's all relative.
Yeah, all relative, yeah.
The WHO guide, actually, they give some really interesting examples. Like, if Lassa fever pops up anywhere, it's instant chills down any epidemiologist's spine, right?
Yeah.
Immediate emergency. But for something like malaria, which sadly is a familiar foe in some parts of the world,
Right.
the alarm bells really start ringing when cases jump way, way above what's normal.
Gotcha. Okay, so let's say we have a bona fide emergency on our hands. What's the playbook? Like, how do we mobilize and actually fight back against this thing effectively?
This is where having a really solid emergency health service is critical. They call it EHS for short.
Okay.
Think of it like it's your disease-fighting headquarters.
Right.
You need a designated leader, somebody who can make the big decisions, right,
Yeah.
and rally all the troops.
So having a plan in place before things hit the fan is like everything.
Oh, absolutely.
No time to be scrambling when lives are on the line.
Nope, no time for that. A good EHS, it's like a well-oiled machine. Contingency plans, early warning systems in place to spot any unusual disease activity, right? They even have these specific investigation and control schemes
Wow.
tailored to whatever the region's potential threats are.
Yeah.
So imagine a region that's prone to mosquito-borne illnesses. They've got this whole plan ready to go if all of a sudden dengue fever cases start spiking.
So it's like mosquitoes. We got this. Here's the playbook.
Exactly.
I feel safer already just knowing those plans exist somewhere. But here's a thought. What about the community?
Yeah.
Like, it can't just be experts swooping in to save the day, right?
Yeah, you're absolutely right. And the document, actually, it's really big on community participation.
Okay.
It's not just these top-down orders. It's about really giving people the power to be part of the solution.
Right.
I mean, think about it. They know their own communities best.
Makes sense. It's like a neighborhood watch, but for disease outbreaks.
Yeah.
Which I kind of love.
Yeah.
But speaking of teamwork, what happens when an outbreak is so bad it totally overwhelms a country's resources?
Yeah.
That's got to be where international aid comes in, right?
You got it.
Mm.
Organizations like the WHO, they're like the global first responders, right?
Mm-hmm.
They can send in experts. They can connect countries with their network of specialists. They even have these emergency health kits.
Really?
Yeah, it's like a pre-packed toolkit for fighting epidemics.
That's incredible. It's like having a global safety net. But hold on. Wouldn't it be amazing if we could, like, predict which countries are vulnerable to an outbreak in the first place before it even happens?
Yeah.
Like, assess the risk factors and be ready.
Well, that is actually one of the key points that the document digs into. There are a few factors to think about. Number one, how could the disease even get into the country in the first place?
Right.
You got to think travel routes, trade, that kind of stuff. Then you got to think about the population. How susceptible are they? A community with low immunity to a particular disease, well, they're obviously going to be way more vulnerable.
Of course. And you can't forget the environment, right? Some climates are just like an open invitation for certain diseases.
Exactly. You have to consider all those angles. So let's say, worst case scenario, a disease does manage to sneak into a vulnerable population. What happens then? What are those very first steps in an epidemiological investigation? What does they actually look like on the ground?
Yeah, it's like the detective work begins, right? Where do you even start?
First things first, you got to confirm that the initial reports, are they even legit?
Right.
And then verify the diagnosis. Are we really dealing with what we think we're dealing with?
Hmm.
Lab tests, those become your best friend at this point.
Yeah.
And then, this is one of the most important steps, you got to establish a really clear case definition.
So you're not just dealing with, like, a vague sickness.
Wow.
You're actually categorizing cases.
Exactly. The document really emphasizes this. Classifying cases as, confirmed, presumptive, or suspect based on their symptoms, lab results, and if there are any epidemiological links.
Okay.
It helps you paint a much clearer picture of what you're actually up against.
Got it. Okay, so we've got our confirmed cases, we've got a detective hats on. What happens next in this whole epidemiological whodunit?
Time to gather intel.
Uh-huh.
And lucky for us, the WHO guide, it's got us covered. They are these handy forms. Form A, that helps you collect all the nitty-gritty details about each individual case, like their symptoms, where they've traveled, any potential exposures, all of that.
Okay.
And while we're doing that, we're also using Form C to do community surveys to get a sense of, okay, how widespread could this thing be?
It's amazing to think how these forms, even from 1986, they help bring order to what could easily be complete chaos. It's like having a standardized toolkit for every outbreak investigation.
Absolutely. And then there's contact tracing,
Ah.
which can be done kind of looking backwards, like retrospectively, trying to find, okay, where did this infection even come from? And then prospectively looking ahead and saying, all right, who else might get sick? Who are the potential new cases, even before they start showing symptoms?
It's like solving a puzzle, right? Tracing the disease's path through the community.
Exactly. Each contact is another piece of the puzzle. And then, if we suspect there's a common source of the infection, like contaminated food or water, well, that kicks off a whole other set of investigative steps.
This is already so much more complex than I ever imagined. I bet we've only scratched the surface here.
Yeah, we've laid some good groundwork, but there's still a lot more to uncover.
All right.
Next up, we're going to dive into the world of data analysis and hypothesis formulation.
Ooh, exciting.
Like, how do we take all this information, all these pieces of the puzzle, and start to figure out what's really going on?
It's like building a case against the disease, right? Well, hold on to your hats, folks, because in part 2, things are going to get even more interesting. We'll be right back.
So we've laid all that groundwork, right?
Uh-huh.
Gathering the information, piece together those early clues. Now let's roll up our sleeves and talk action. Like, how do we actually combat an epidemic once it's here?
Yeah, this is where it gets really interesting, I think. Putting all those detective skills to work and actually, like, fighting back against the outbreak.
And this 1986 WHO guide, it's surprisingly relevant here, too. They break down control measures into 2 main categories. You've got measures that are focused on the patients who are already infected. And then you've got measures that are aimed at the whole community.
So you're kind of tackling the disease from both sides then.
Just
containing the spread, but also protecting the folks who aren't sick yet.
Right. So let's start with those patient-focused measures.
Yeah.
One of the most, I guess you could say, fundamental concepts here is isolation.
Ah, yes. The classic quarantine. I've seen enough movies to know how that goes.
Well, it's not always as dramatic as Hollywood makes it seem.
Yeah.
But the level of isolation needed, it really depends on the disease, right?
Yeah.
How contagious it is, how it spreads. The guide, it actually outlines different levels of precaution, starting with standard precautions, going all the way up to strict isolation for the really, really contagious and dangerous stuff.
So, like, for a disease that spreads through contaminated food, you might be okay with just standard precautions. But for something that's, like, airborne and super infectious, you need a much more, I guess, intense approach.
Exactly. And it's important to remember, the point of isolation, it's not to punish anyone. It's to break that chain of transmission and stop the disease from spreading any further.
Right, that makes sense. And I bet contact tracing plays a huge role in all of this, too.
Oh, absolutely. It's like a detective following a trail of breadcrumbs, right?
Sure.
We're identifying everyone who's been in contact with someone who's infected, and then we monitor them, watch them really closely for any signs of the illness. Early detection, that's really the key to containing an outbreak.
Right, okay. So that kind of covers the individual patient side of things. What about those broader community strategies?
Right.
The ones that are meant to protect everyone?
Well, if you're dealing with an outbreak that has a common source, something like contaminated water, for example,
Yeah.
The top priority is getting rid of that source and shutting down that transmission route.
Okay, so for a waterborne illness, that might mean doing things like chlorinating the water supply or finding the source of the contamination and fixing it.
You got it. And for outbreaks that are spread by vectors, like mosquitoes.
So fun.
The guide, it actually dives into all these different control strategies. Insecticide spraying is one option, but it's not always ideal.
Yeah, I can imagine there are environmental concerns with using too much insecticide, right? It's like you're solving one problem, but maybe creating another one.
Exactly.
Yeah.
That's why the document really pushes this integrated approach.
Right.
Alongside the spraying, you might also implement personal protection measures, things like bed nets or mosquito repellents. And then there's source reduction, where you actually target those mosquito breeding grounds.
So get rid of any standing water,
Yeah.
make the environment less friendly to mosquitoes.
Right. And then there are things like environmental management techniques. Improving drainage systems can make a huge difference.
Wow.
It's all about making it harder for those disease-carrying pests to thrive.
It's like we're waging war on multiple fronts, not just against the disease itself, but against everything that's helping it spread.
Right. And it's not just mosquitoes we have to think about. The guide also talks about strategies for controlling other types of vectors, things like rodents, which can spread some nasty diseases.
Like plague.
Exactly. Plague, Lassa fever.
It really is a multifaceted battle. This is fascinating, but it also kind of makes me wonder, how do we know when we've actually won? Like,
Wow.
when is an outbreak officially over?
That's a great question. The guide, it lays out some criteria, but it's not always a black and white answer.
Okay.
It really depends on the disease.
Yeah.
How long is the incubation period? How does it actually spread?
Right.
So for a disease that spreads directly from person to person, you might consider the outbreak over if there haven't been any new cases for a period of time that's equal to the longest known incubation period for that disease.
So you're basically making sure enough time has passed that any kind of hidden cases would have popped up by then.
Right, exactly. And for a disease that has a common source, like that contaminated water example we talked about,
Yeah.
you'd be looking for confirmation that the source has been completely eliminated.
Right.
It's no longer a threat.
So it's not just about the absence of cases. It's about really understanding the disease and how it works and making sure that all those transmission pathways have been shut down.
Exactly. But even after an outbreak is declared over, the work isn't done. The guide really stresses the importance of post-epidemic surveillance.
So we're still keeping an eye out just in case there are any, like, smoldering embers that could spark a new fire.
Exactly. And this post-epidemic phase, it's also a really good time for reflection.
Yeah.
Analyzing what happened, how we responded, and if there are any areas where we could improve.
It's like a debrief after a mission,
Mhm.
figuring out what worked, what didn't, and how we can be even more prepared the next time around.
And this is where international cooperation becomes super important. Sharing information and expertise between countries, that's crucial for making sure our global response keeps getting better and better.
It's a good reminder that we're all in this together. An outbreak anywhere, it can potentially affect everyone, so we really do have to work together if we want to stay ahead of the curve.
Absolutely. And that brings us to another really important point. Immunization
Ah, yes, vaccines.
and chemoprophylaxis.
They often feel like the superheroes of disease prevention, you know?
They really are incredibly effective for a lot of diseases. But the document makes it really clear. Immunization, it's primarily a preventative measure, something you do beforehand. It takes time for those vaccines to really kick in and for that immunity to build up in a population.
So not always the best solution in the middle of an active outbreak. It's like you need those defenses already in place beforehand.
Right, exactly.
Yeah.
But there's certain situations where vaccines can be helpful, even during an epidemic. And the guide, it actually gives some guidance on when and how they could be used. And then there's chemoprophylaxis,
Okay.
which basically means using medication to prevent infection in people who have been exposed or people who are at a really high risk of getting sick.
So it's like a preemptive strike against the disease, trying to stop it before it even has a chance to take hold.
Exactly. And obviously the types of medications used, that's going to depend on the disease and the specific circumstances. So well, we've covered a lot of ground here, haven't we? We've talked about isolating patients, tracing contacts, tackling those environmental factors, even thinking about preventative strategies. And it's pretty clear there's no one-size-fits-all solution when it comes to controlling epidemics.
It really seems like it's all about tailoring the response to the specific disease and the context of that particular outbreak. But what really strikes me is how much of this 1986 guide, it still holds true today. Sure, we have new tools and technologies now, but those core principles, they're the same.
It really speaks to the enduring nature of public health, doesn't it? But of course, we can't ignore the fact that the landscape of infectious diseases is constantly changing. We're
Yeah.
seeing new and emerging diseases all the time.
Mm.
And then you have the old foes that are evolving, getting tougher, developing resistance to the treatments we've relied on for years.
It's like this constant arms race, isn't it? Trying to stay one step ahead of all these little microscopic threats. So after this whole deep dive into epidemic response, what's the big takeaway you want to leave our listeners with? What's the most important message?
I think it comes down to this. While outbreaks can definitely be scary and often very unpredictable, we're not powerless.
Right.
There are a lot of really dedicated people and systems out there that are working incredibly hard to protect us. But we all have a role to play in this fight.
It's about understanding that we're all interconnected, part of a larger system, really. And just like those epidemiological investigations we talked about, it takes a collective effort to keep that system healthy and strong and resilient.
I love that. Beautifully put. So what can our listeners do? Stay informed about potential threats. Practice good hygiene. The basics go a long way. Get vaccinated when it's recommended. And support public health initiatives in your communities. Even small actions like these can make a huge difference.
It's about recognizing that we're not just passive bystanders, we can actually be active participants in protecting ourselves and our communities from all these microscopic enemies.
Exactly. And remember, knowledge is power. The more we understand about epidemics, how they work, how we can respond effectively, the better prepared we'll be for whatever challenges come our way in the future.
Well, thank you so much for taking us on this fascinating journey into the world of epidemic response. It's really been eye-opening, and I hope our listeners are leaving today feeling empowered.
Oh, it's been my pleasure. And here's to a future where we can all stay one step ahead of those pesky outbreaks. Until next time, stay curious and stay healthy.
We've covered a lot of ground, haven't we? I mean, really journeyed to the heart of how we respond to these epidemics. From those first moments where, hearts are racing, trying to figure out what we're dealing with, to like all those intricate steps, investigating, figuring out how to control these things. It's been quite the ride.
And the thing is, even though that WHO guide we keep coming back to, that's from way back in 1986, so much of it still, it just makes sense. It's like the fundamentals haven't really changed that much.
That's true. It really makes you realize that, yeah, okay, the diseases themselves, they're always changing, they evolve. But how we fight them, those
Right.
core strategies, it's almost like they're timeless.
Absolutely. But we can't ignore the fact that the world of infectious diseases, it's a moving target, right? We've got new threats popping up all the time, emerging diseases, things we've never even seen before. And then those old foes, they're getting, like, tougher, developing resistance to the very things we've always used to fight them.
Yeah, it's like a constant back and forth. A game of cat and mouse, I guess you could say.
Sure.
Trying to stay one step ahead of these tiny little, well, threats.
That's a great analogy. It's like one of the biggest things we're dealing with right now, antimicrobial resistance. I mean, think about it. Bacteria that were once, like, easy to treat with antibiotics,
Right.
they're becoming resistant, which means infections are getting harder to cure. Sometimes impossible even.
Yeah, it's a scary thought. It really makes you realize we can't just sit back and think we've got it all figured out. We got to keep innovating, keep researching,
Yeah.
coming up with new ways to fight these evolving threats.
I couldn't agree more. And there's another challenge that's become even more obvious, I think. The impact of how quickly things move around the world.
Globalization.
Globalization, exactly.
Yeah.
And travel.
Yeah.
Diseases can spread so much faster, so much further than ever before, which makes containing them, well, that's a whole other story.
The world feels like it's shrunk, right?
Yeah.
Which is great for, connecting people and cultures. But when it comes to outbreaks, yeah, not so great.
Not so great, no.
Yeah.
That Ebola outbreak back in 2014, that was a wake-up call. Showed us how quickly a local problem, boom, global concern.
So after spending all this time diving deep into this world of epidemic response, what's the big takeaway? What's the one thing you really want our listeners to walk away thinking about?
I think it all comes down to this. These outbreaks, they can be scary, they can be unpredictable, but we're not helpless.
Right.
There are a lot of people out there, a lot of systems that are working really, really hard to keep us safe. But everyone has a role to play in all of this.
It's about understanding, we're all connected. We're part of this bigger system. And just like those investigations we talked about, it takes everyone working together to keep that system healthy, strong, resilient.
I love that. It's beautifully put. So what can our listeners do? Okay. Stay informed.
Yeah.
Know what the potential threats are. Practice good hygiene. I mean, the basics, they really do make a difference. Get vaccinated, follow those recommendations, and support. Support your local public health initiatives. Those things, they might seem small, but they can make a huge difference.
It's about understanding, we're not just sitting on the sidelines watching all this happen. We can all be part of the solution.
Absolutely. And knowledge is power, right?
Yeah.
The more we understand, the better we'll be able to handle whatever comes our way.
Well, thank you so much for taking us on this incredible journey. Really, it's been fascinating. I hope everyone listening feels, I don't know, a little bit more empowered to be part of the solution.
It's been my pleasure.
Yeah.
And here's to a future where, we can stay ahead of these outbreaks. Until next time, stay curious and stay healthy.